Hey everyone, welcome back to the Agenda Now channel. Today's video breaks down a heated exchange from Capitol Hill, where one witness laid out the brutal reality of skyrocketing healthcare costs, and a senator fired back, blaming it all on the Affordable Care Act. The numbers are shocking, the arguments are intense, and the stakes couldn't be higher for families dealing with real medical needs. Let's get straight into it. So, here's how it all started. The senator begins questioning the witness about her long, complicated history with health insurance. I walk through the story she shared, from employer-sponsored plans to the ACA marketplace. Back in 2013, even with employer coverage, she paid $600 a month just because she was a woman of childbearing age, and that was with insurance through her job. This sets the tone for what becomes a financial roller coaster. Fast forward to 2016, her employer drops coverage entirely. Suddenly, the Obamacare exchange becomes her only option. By 2019, she's paying around $1,000 a month for a higher-tier plan. Deductibles were lower then, but the price tag was still painful. Then, in 2021, she downgrades to a bronze plan at about $250 a month, though even she's unsure if subsidies helped cover the cost. Before we go deeper, go ahead and click that subscribe button if you want more breakdowns like this every week. Now here's where things escalate. Her projected 2025 gross premium, well, it's around $18,000 to $19,000 a year. She'll pay $8,400 out of pocket. The rest, about $10,000, comes from subsidies. The senator highlights this to argue that the real problem is the gross premium itself, not just the subsidy system. The senator then makes his big point. He claims the ACA's design shifted the cost of covering pre-existing conditions almost entirely onto people in the individual market, and according to him, that's why premiums have, quote, skyrocketed. He says Wisconsin's former high-risk pool did a better job spreading costs before the ACA eliminated it. His argument is blunt. The law made coverage more expensive, and temporary subsidies only mask the underlying problem. But the witness fires back with a reality check. For her family, fighting the risk of Huntington's disease, the ACA isn't optional, it's the only coverage available. She urges lawmakers to stop the partisan fighting and work together to lower costs, rein in corporate pricing, and extend premium tax credits. She reminds them that everything, groceries, gas, utilities, is going up. Raising premiums even more is simply not an option for families like hers. At the end of the day, this back and forth exposes a massive divide in how policymakers think the healthcare system should work. One side points to structural flaws in the ACA, the other says families can't survive without it. Whatever the solution is, the price of doing nothing is hitting real people hard, and hitting them right now. If you found this breakdown helpful, make sure to like the video, drop your thoughts in the comments, and of course, subscribe for more deep dives into the stories shaping our country. Thanks for watching.
I'll start with questioning. You know, I purchased healthcare in Wisconsin for my smaller business for about 30 years, and just quite a few years before we even got over 100 employees. So I'm very familiar with the small employer market. We actually had, for 1 year, when one of the companies was really trying to buy share, where we had $0 deductibles. I mean, literally, everything was covered. There was no deductibles. There was nothing. I think next year they raised premiums 40%. We had to, switch over. But we were talking about $100 deductible per person with out-of-pocket maximum of a couple thousand. I think when I left in 2010, the most I ever remember was a couple deductibles, $2,500 per person with an out-of-pocket maximum about $5,000. Again, it's off the top of my head, but again, nothing like you're describing right now. So I would like to, and again, appreciate you working with our staff trying to fill in the details here, but I'd just like to kind of get a feel for, what your current situation is and kind of where you've been in terms of healthcare. So going back to 2013, I'm showing you the rate of increase since the implementation of Obamacare. What kind of insurance did you have in 2013?
Yeah, in 2013, our gym was a bit larger. It's a racquetball gym, so I don't know if any of you play racquetball. You probably don't know many who do. Therefore, it has gotten to be much smaller. And back in 2013, we did have employee-sponsored healthcare at that time.
Okay, so you had employer-sponsored?
Yeah.
Did you contribute anything to it?
I did, and it was actually really...
I don't expect you to remember. Do you remember approximately?
No, I sure can, and I remember this because my husband and I weren't married yet. And because I was a female of childbearing age, I paid almost $600 a month. Okay. And he had to pay under $200 a month, and we found that really unfair. So it was actually, even though it was employee-sponsored, still quite unaffordable.
So then 2014, 2015, you're also on employer-sponsored care, correct? Is it
Yes.
was the same one, similar
Yes.
types of rates?
Yes.
So again, you were paying about $600 a month.
Yes. Okay. I can't give you, I apologize, I don't have the exact numbers on me.
So in 2016, your employer no longer covered employees, so you end up having to get your insurance through the Obamacare exchanges. Next thing I have is in 2019, you were paying $1,000 a month for a silver plan.
In 2019, I don't know if it was a silver plan. I know it was a higher tier plan that we have
That's what you told us
right now.
when you were looking.
Yes. So
Okay.
I chose a higher plan, and it was about $1,000 a month.
Do you remember what the deductible was? And by the way, do you have deductibles and then an out-of-pocket maximum? Is that how that works on your
Yeah,
exchange?
this year I don't have deductibles. I have fairly high copays and an out-of-pocket maximum. I do not remember what my deductibles were in that year that I was paying about $1,000, but I
Okay.
know they were significantly less than they are now. We have a lower tiered plan now.
Because now you say you switched to a bronze plan, and that was $250 a month. But you said I'm assuming you're assuming it's out-of-pocket maximum of $14,000, or is that just a deductible of $14,000?
The $14,000, I believe, is an out-of-pocket maximum. It's not $250 a month. It's $460 a month.
No, in 2021.
2021.
That is $250 a
Okay,
month.
yeah.
So now.
Yes, when we dropped to that lower tiered plan, yes.
And you were getting subsidies back then.
I don't believe so.
Back in 2021, you weren't qualifying for subsidies?
I can't recall.
Okay, I would think paying $250 a month, you probably were. Can we put up this next chart? And I've got this sheet in front of you. I've tried to cobble together what I think is representative of the kind of plan you're on. I'm not saying that this is yours, but this would be somewhat similar. This is a bronze plan. So for 2025, you're saying that your net premium is $460, and I know in your House testimony you said you had a subsidy of $800, so your gross premium was $1,260 a month. So on an annualized basis, that's $15,000 gross premium. You got a $9,600 subsidy, and you paid $5,500. Okay. Now, in Wisconsin, we're not the national average 26% increase this year. We just read this about 17%, but I did this based on 26. So assuming the national average gross premium increase, your total annual premium is going to go from $15,000 to about $19,000. Is that about what you're seeing in your? It's probably a little less than that because what I heard in Wisconsin, our average is about 17.
A little less than that, yeah.
Okay, but somewhere around $18,000, $19,000.
Yeah.
You're saying you're going to now be paying $700 a month. So that translates to $8,400 annually, correct?
Yes.
Times 12.
Yes.
So that means you'll be getting a subsidy still of about $10,600, roughly, about $10,000 subsidy.
No, my subsidy is
If your premium's
$420.
$18,000, $19,000, you're paying $8,400, you're going to get about a $10,000 subsidy, even with the enhanced subsidies going away, the temporary subsidies, when they expire.
Yeah, the enhanced was much more than that. Right now, it would go down to $400.
Okay, the last column is, what I did is I deflated the $19,000 back to 2013. And that gives us about $8,500 is what your premium, a similar type of plan's premium would have been before the ACA. Then if I reinflate it, based on employer-sponsored insurance, going up about 64%, your premium should be should be less than $14,000. That's a $5,000 difference. Now, if you inflate it just based on inflation, 39%, you'd be saving about $7,500 in premium. So again, I'm just laying this out. This is what's happening. So there's no reason for a plan like yours to cost $19,000 a year. But even with the temporary subsidies that, again, we're not the ones that set those to expire. That's what the Democrats did. Even with those subsidies expiring, again, you'll still be getting $10,000 to $11,000 subsidy. The problem is the premium, the gross premium, and that is being, we'll talk about this later with our other witnesses, that's Obamacare's faulty design. The fact that it forced all of the individuals like you in these individual policies to bear the full cost of covering people with pre-existing conditions. Prior to Obamacare in Wisconsin, we had something called a high-risk pool. It worked great. Now, it wasn't perfect. You could have tweaked it to make sure that everybody with pre-existing conditions were covered, but Obamacare did away with those and put that full cost of covering people, pre-existing conditions, on the backs of people like you. That's why health care primarily is so expensive on the individual exchange. There's many other reasons, but we'll get that into witnesses.
Is this can I answer?
Sure.
I know it wasn't exactly a question, but again, I'm not here to speak on, I'm clearly not an expert on why the co-pays and why the premiums and everything are rising. But I do know that the Affordable Care Act is the only option for coverage for my family. It's the only option for coverage for Huntington's disease families, for entrepreneurs. And I would really hope that lawmakers would work together to help rein in this corporate spending to help bring that down. And quite honestly, yes, the premiums are going up, but so is my gas, so is my electricity, so are my grocery prices. And I don't feel like the answer to this is to increase our premiums more. I know you said this is Democrat sponsored, but Republicans and everybody have the power to pass this extended premium tax credit so our bills don't go up even more. I'm not here to fix this today, but please help us for 2026.
The reason this is your only option is because Obamacare made it your only option. The reason you can't afford it is because Obamacare made premiums skyrocket. So again, it doesn't make any sense to throw hundreds of billions of dollars to hide and mask the faulty design of Obamacare. I am happy. I would be more than willing to sit down in good faith to work with Democrats to repair the damage done by Obamacare and transition to a system that actually keeps costs down. But again, when you've gone from an insurance policy that was probably about somewhere around $8,000 before Obamacare to now it's $19,000, four times more the rate of inflation. Yeah, everything's up, but everything's up 39%. Obamacare rates are up, what did I say, 169%? I forgot the exact figure. Again, it's the faulty design. With that, I'll turn it over
respectfully, Senator, if I had tested positive for Huntington's disease, what would my option have been then? Again, I wouldn't have had an option.
So what we would have done is high-risk pools. We would have had guaranteed issue within those. The cost would have been spread over everybody. That's the way it was originally.
My friends who tested positive were not able to afford
had a small percentage onto their insurance, and it paid for the high-risk pools. It worked marvelously, but Obamacare outlawed that. But anyways, Senator Blumenthal.